The background on this poster is that atrial fibrillation is the most common arrhythmia in the world. There are about 20 million plus people in the world with atrial fibrillation, and patients with atrial fibrillation are at increased risk of stroke relative to the general population without atrial fibrillation. One of the treatments for stroke is oral anticoagulation, and one of the longest standing therapies for oral anticoagulation is warfarin therapy. Patients need to keep their INR values between a range of 2.0 to 3.0 to have the benefits of warfarin without increasing the risks of bleeding, and that will then prevent strokes at the lowest increased risk of bleeding. But one of the questions is there are more recently some non-vitamin K antagonist oral anticoagulants that are available and have been approved by the FDA, and one of the questions is whether or not patients that have done well on warfarin historically should be switched to these new medications. So we use the Orbit AF registry, a US registry of patients with atrial fibrillation, to answer this question, and we looked at patients who had 9 INR values over an 18-month period to make sure that we captured patients that were chronically on warfarin therapy. Within this group, we had about 3,700 patients who met those qualifications, and we looked in a landmark type analysis to see how many patients had INR values in the 2.0 to 3.0 range over the first 6 months, and then looked to see what their subsequent INR values in range were over the next year. And we defined stable patients as patients that had at least 80% of their INR values in range for that first 6-month period. We found that 99% of patients had at least one INR value outside of the 2.0 to 3.0 range over that 18-month period. And there were only 1 in 4 patients that had at least 80% of their INR values in the 2.0 to 3.0 range over that first 6-month run-in phase. And then within those patients, 92% of them went on to have at least one INR value out of range over the subsequent year, with patients, almost 35% of patients having at least one INR value well out of range, less than 1.5 or greater than 4.0 over that subsequent year, despite having greater than 80% of their INR values in range for the 6-month run-in phase. I think that this is very important research for practicing clinicians, because one of the questions is, if patients have done well in the past on warfarin, will they continue to do well on warfarin? And this study at least raises the question that maybe we have overestimated how well patients will continue to do on warfarin in the future, and that maybe we need to consider more patients for switching to one of the non-vitamin K antagonist oral anticoagulants. I think that the next steps in this research will be to look at outcomes of these patients and better define how these patients do over time clinically.